Hello everyone. We discussed anatomical snuff box yesterday, and I requested everybody to study about the scaphoid and other carpal bones. So let's begin and start revising about the scaphoid one. As you can see, these are the images of the scaphoid bone, and as you can see on my right hand side, there is certain information written, and you can read that very clearly, that this scaphoid bone, as it says, it's most probably the worst bone that gets fractured. And I'll show you the entire in the entire arm or entire hand, you could say. That is the worst bone, yes, worst carpal bone to get fractured. Or why? We'll discuss this in a second. If I can show you, this is the image. If I show you, yesterday we were talking about anatomical snuff box. Here, have a look. So these are the muscles. In between these two muscles, tendons of extensor pollicis brevis and abductor pollicis longus, laterally and medially and laterally, medially and laterally, tendon of extensor pollicis longus. This is the anatomical snuff box, and in the base of the anatomical snuff box or the floor, you can palpate or feel the scaphoid carpal bone. So coming back to the normal picture over here, if I can show you this image, let me enlarge it. Hang on. Yes, here. This. Have a look. This boat-shaped carpal bone, which is on the lateral side. This is, remember, this is radius and this is ulna. This, is located in the proximal row. This is the proximal row. Have a look. And this is the distal row of the carpal bones. There are 8 carpal bones. While we are studying or learning scaphoid, have a look. This is radius. This is ulna. Have a look. If you want to remember the exact location or the exact position of the scaphoid bone, so there are many idioms or many sentences or memes people have created just to remember the exact order of these carpal bones. So they say, she looks too pretty, try to catch her. So if we talk about she, so scaphoid, looks, lunate, too, triquetrium, pretty, pisiform, as you could see. Let's move on. And then second row, try to, this is trapezium, trapezoid, catch, capitate. Last one, hamate. See? So these are the 8 carpal bones, and among those in the proximal row, on the radial side or laterally, radially, however you want to remember it, this is the shape of the scaphoid bone. What they say, that the scaphoid bone, according to Greek word, it's a Greek word, scaphoid bone. Scaphoid is a Greek word, which means both like, and it also means kind. So this is the shape of the scaphoid bone. Coming back to the previous picture. Right, which else image I can show you? Maybe you can have a look at this one. Let me enlarge it for you. This, okay, enlarged. Yes, have a look now. Enlarge. This red area is the scaphoid bone. Again, If you learn anatomy, it's so easy. These are the carpal bones. See, the proximal row, the distal row, proximal. Why are these called proximal? So it's anatomy. It's so easy. Proximal with respect to or with regard to the body, closer to the body. So proximal, distal to the body or away from the body. So distal. See, so this is distal. This is proximal. Very good. And now you can see exact location where this scaphoid is located. Now I'm going to tell you a little bit more about it. See what they say about this scaphoid bone, that you've learned where exactly it was situated, how exactly it does, what exactly it does. So what they say, it's one of the largest bone in the proximal row of the carpal bones, and it forms the radial border of the carpal tunnel as well. So that's one of its function. Right, what more it does? It helps, or yeah, it's the proximal row of the wrist. It's along the long axis, being from the above downward, lateralward, and forward. So it's approximately the size and shape of a medium-sized cashew nut. In another image, if I could show you exactly, wait, in another image, here, maybe, yes. If I'll show you in another image here, it's this, wait, the bottom here, wait. Yeah, so I said it's approximately, see, this is the total image, approximately of a size of a medium cashew nut. So that's the shape of this is the shape of the scaphoid bone. What more I can tell you? So basically, it articulates with 5 bones. Radius, it's most proximally, trapezoid bone and trapezium bone distally, capitate and lunate medially. So it articulates with these 5 bones, neighbors. About the structure of scaphoid, let me tell you, you already have learned that it's situated between the proximal and the distal row of the carpal bones. It's located on the radial side of the wrist, exactly adjacent to the styloid process of the radius. And it articulates with the radius, lunate, trapezoid, trapezium, and capitate. All of these explained already to you. And 80% of the scaphoid bone is covered with articular cartilage. So, what have you learned? 80% of the scaphoid bone is covered with the articular cartilage. So, it gets articulated with these 5 bones, which I've told you. If I tell you that the palmar surface, see, this is the palmar surface of the scaphoid bone. You can see it is concave. See, it's concave. Concave means carved in, dipped in, so it's concave. And it forms distal, it has a forming distal, see, forming distal tubercle, which gives attachment to the transverse carpal ligament. And the proximal surface here is triangular. Have a look. Proximal surface here is triangular, as you could see. It's smooth and it's convex. See, it's opposite to the distal surface. This is concave, cup-shaped. This is convex, opposite. See? Whereas if you can look at the lateral surface, is narrow. Lateral surface is narrow, and it gives attachment to the radial collateral ligament over here. Radial collateral ligament. The medial surface has 2 facets. You could see. You could see. Medial surface has 2 facets. You could see. 2 facets. 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 2 a flattered semilunar facet articulating with the lunate bone, and an inferior concave facet articulating alongside the lunate with the head of the capitate bone. And the dorsal surface of the bone is narrow. Dorsal surface would be the opposite side. It's narrow with a groove running the length of the bone and allowing ligaments to the attachment. And the surface facing the fingers, anatomically inferior surface, is smooth and convex, also triangular, and divided into two parts by a slide ridge. So that's the inferior part. That's the whole structure or anatomy of the scaphoid bone, if I can clearly tell you. Now, if we talk about the blood supply of scaphoid bone, so let me tell you, scaphoid bone receives its blood supply by the radial artery and via the dorsal branches of the radial artery, and they provide abundant supply to the middle and the distal portion of the bone. But the proximal portion gets neglected and it gets its blood supply by a retrograde flow. So the dorsal branch of the radial artery, here would be some image. Let me find out and show you. So what I was telling you, the dorsal branch supplies the majority of the middle and the distal part of the scaphoid bone, whereas the palmar branch turns around and supplies only the distal third of the bone. So that is why it's important. So if you get any hand sprain, or if you fell, if you get injured or something, or patient comes to you with the complaint of tenderness or tingling sensation or pain in the wrist, then it's very important that you should pay close attention to it. There could be consequences that can be very costly for the patient. Let me tell you one thing before we move on to the clinical significance of the fracture of the scaphoid bone. You'll always wonder, why would you have this scaphoid bone in the hand? So let me tell you, one of its functions is to provide a bony, you could see here, where is my cursor? Yes, here. You could see it provides a bony superstructure for the hand. So other than its function, it's providing the bony structure to the hand. Scaphoid bone is also involved in the movement of the wrist. Exactly, okay? So along with the lunate bone, which is the neighboring bone, the lunate bone, the neighboring bone, it articulates with the radius and ulna, articulates with the radius and ulna, and forms the major bone's involvement in the movement of the wrist. So scaphoid serves as a link between two rows of the carpal bones, distal row of the carpal bone on one side, and the bones of the forearm, radius and ulna on the other side. So with the wrist movement, the scaphoid may flex from its position in the same plane as the forearm to perpendicular. So the purpose of telling you this is, that is why the shape of the scaphoid is concave proximally, or on the volar side or the palmar side. Now, it's very important. Here I can show you one image. This is the image of the fracture. If I could enlarge it and show you. Come on. Okay, have a look. Have a look. Yes, here, let me fix it. Yes, this is a smaller or not zoomed view. You could see this is the right side, and if it's of a person who fell playing basketball, definitely in an outstretched hand. So what you could see over here, red arrow pointing at, have a look. What do you see? This is the scaphoid bone, which has been divided here exactly. See how visible that is? But that is not the case in all the cases. It's not visible in all the cases. And as I have told you before, that scaphoid bone is very crucial and very important, and it gets its major 2/3 of its blood supply by the dorsal branches of the radial artery, and only the proximal 1/3 of the carpal bone, of the scaphoid bone, gets its blood supply from the volar branches of the radial artery. So what happens that if these bones are not aligned together, or if there is a fracture which can easily be missed, so if you miss the fracture and patient is continuously complaining about the tenderness and pain and the tingling sensations in the hand, this will lead to delay in the healing of the scaphoid bone, which will cause the malunion or the non-union. And even if healing is compromised, or if healing fails to occur, it can even lead to non-union of the scaphoid bone. And the problem with this non-union, if I tell you, could be that it leads to post-traumatic osteoarthritis of the carpal bone. Patient will complain of the pain many days and many weeks and many months even after the incident. That is all because of its fragile blood supply. So it's very important as a surgeon that you rapidly immobilize the fracture, and you require the surgical treatment, which includes the use of headless compression screws like Herbert screws, and they bind the two halves together. In case of healing for a non-anatomic deformity, you can also use humpback that leads to post-traumatic arthritis, or non-union can result in the loss of blood supply to the proximal end, and then can also lead to avascular necrosis of the proximal segment. So the scaphoid fracture may be difficult to diagnose because of the X-ray in the early days. Where exactly are the images? Let me find out. If not this one, then wait. Yes, here. Management, as you could see. See, that is how you can manage this is the splint that you could use, and you can use this for 12 weeks. If you'll keep the arm proximal or 2/3 of the arm and the hand like this, in this splint for 12 weeks, this will help in the healing, and it will help in the alignment. If that is especially done if the fracture parts of the scaphoid bone could be aligned even without surgical intervention. But if they cannot, then you have to do the screw intervention, which I told you, compression screw. So in the previous image, oh wait, here it will be, as you could see, it becomes the case of orthopedic department. See, what more I can tell you exactly? Wait. Okay. So I have told you all this exactly. So what happens that Complications, I will repeat again. There could be avascular necrosis, there could be malunion, non-union, uh, or there could be post-traumatic arthritis. So this is one thing that can occur. Symptom with what patient will present. That patient will complain about tenderness in anatomical snark box. If there is a vascular necrosis, then again patient will receive, again will complain. Mechanism treatment, I told you. Right. I can tell you again in detail later on how exactly we can manage, but the prognosis, they say, for non-union is only 2 to 5%. Otherwise, it can get managed very nicely. So 90% of the non-operated individual, they return to their work normally. Only 88% they reach the previous level, like, all right, okay, 12% you can say there is. Whereas among those who underwent surgery, rate of returning back to normal activities 98%, very good result, and 96% is become as normal as grade 0 like before. So average time observed for resuming their activity is 14 weeks for non-operated individuals and 7 weeks for those who had hand surgery. So that is that. What more I can tell you? Right. What more I can tell you is that, okay, there was one blood supply image. Wait, I can show you. There was one image of the blood supply in which you could see really good. Yes, here, have a look. Images of the blood supply of the. Let me show you this image. Have a look. Beautiful, clear. See the two branches? This is the volar branch. It's supplying just to the proximal 1/3. And the dorsal branch, this is the dorsal branch. It's supplying to the 2/3 of the radial artery. Have a look. Very nice. See, in this image, you could definitely appreciate. And if I can show you any other image, if you can have a look at the right. This is the dorsal view. See, this is the dorsal view. This is the dorsal carpal branch of the radial artery. Have a look. And this is the radial artery. How it supplies. Have a look. Superb. You can see, because many MCQs can come for MRCS Part A, in which it is very important that you learn all this. And if I can tell you, yes. Right. So this is that. Now you've learned all of this. For tomorrow, you can revise carpal tunnel syndrome and carpal tunnel, flexor retinaculum once again, and entrapment of median nerve, how exactly it happened. And this is what we'll revise in our next revision. This is very important. If there is any question about the blood supply of the scaphoid bone, how it is attached, I'm ready to show you again. See, it is here. I've shown you very nicely, and I'll be able to show you again and again as many times as you will ask. And the most important is about the blood supply. That is very important for you to remember and learn. With this, many MCQs can come. and it is very important. You can compare the scaphoid bone of the hand with the navicular bone of the foot. Very, very common when it comes to avascular necrosis. And what is the condition or disease called when there is avascular necrosis? If or whenever you watch or listen to this recording, do write in the comments and let me know. So I would also know how much you know or you do not know. Then ask. Okay, with this, I'm ending today's revision. Bye bye.